A warm welcome to all of you for joining us for this important conversation on lung cancer, early detection, and healthy lifestyle for better outcome. This discussion was initiated by Integrated Health and Wellbeing Council and supported by Roche. And it comes at a very right time as November is observed as Lung Cancer Awareness Month globally. We are delighted to have with us Dr. Pulkit Nag, who is a consultant medical oncology at Apex Hospital, Jaipur. Thank you, Dr. Pulkit, for being here to share your insight. This topic is highly relevant today, especially with cities like Delhi facing severe air pollution, reminding us how crucial lung health has become today. Let's begin our conversation. Dr. Pulkit, what are the most significant risk factors contributing to lung cancer beyond smoking?
So thank you for so much the interactive session on lung cancer. I think the lung cancer is the problem not only in India, but it's a global problem. And as we are discussing the various causative agents for lung cancer, I think it's a very important discussion for us. So we all know that smoking has been the proactive cause for lung cancer in form of tobacco chewing, in form of smoking inhalation. But there are various other risk factors apart from smoking, which is an alarming concern. The reason for having lung cancer in non-smokers. So lung cancer basically is of three types, that is squamous, small cell, and adenocarcinoma, in which the squamous cell carcinoma and small cell carcinoma are proactively associated with smoking. It's the adenocarcinoma variety which can be found both in smokers and non-smokers. So हमारी इंडियन फीमेल्स में जो कि नॉन स्मोकर्स होती है, जो मिडिल क्लास फीमेल्स होती है जिनमें लंग कैंसर पाया जाता है, वो मोस्टली एडिनोकार्सिनोमा पाया जाता है. And the reason for adenocarcinoma lung can be smoking and non-smoking. Now, if we talk about the causing for non-smokers, one of the causes is radon. So radon is a gas which basically we can see in building materials, and it can be absorbed through earth, through building walls, and also through the ground wells. So people who work in the building material industry or in the shipping industry are mostly exposed to radon. Apart from that, there is people who works in asbestos factory. Asbestos chemical inhalation is also one of the cause for lung cancer in non-smokers. Others is the nickel and chromium, the metals which a lot of the workers work in these industries. They are also exposed to them, and that if after inhalation is also one of the major cause for lung cancer in non-smokers. The apart from them, the another important cause is the environmental pollution. The various gases in the pollution, the various pollutants can also be the important cause for lung cancer in non-smokers. The very important another cause is second-hand smoking. Now, what is second-hand smoking? You are not smoking, but some of your relative, your friend is smoking, and you are sitting next to them, or you are sitting in a public space and someone is smoking. That smoking inhaled by someone else is called second-hand smoking, and that is also an important cause for lung cancer who are primarily not smokers. Another important is the family history. It has been seen that patients who have a first degree relative, that is उनके बेटे या उनके father या mother या real brother sister में अगर strong lung cancer का history है, तो in the coming generation there are high chances that they can suffer from lung cancer irrespective of their smoking history. So I think ये कुछ basic reasons है जिनके कारण से lung cancer non smokers में भी पाया जा सकता है. Yes.
Thank you, Doctor. It's very clear overview and the quite insightful. Moving forward, how can we better educate the public or early on early warning signs and the risk factor to promote early detection?
So prevention is basically I want to start from the risk factor. Everybody knows smoking. You need to like quit smoking. I can speak for hours on that. But I think हम सबको पता है कि smoking कम करनी ही है, बंद ही करनी है, कम करने से भी कुछ नहीं होता. तो आई थिंक अगर आप स्मोकिंग कट डाउन करते हो तो आप एक मेजर चंक ऑफ लंग कैंसर्स को बैटल कर सकते हो. सेकेंड जो नॉन स्मोकर्स है, यानी कि जैसे मैंने बताया रेडॉन एक बहुत इंपॉर्टेंट फैक्टर है. तो आजकल मार्केट में रेडॉन किट्स अवेलेबल है. आप अपने घर पे उसका रेडॉन का एक्सपोजर चेक कर सकते हैं कि इस कितना एक्सपोजर है, और उसके उसके हिसाब से आप प्रोटेक्टिव मेजर्स ले सकते हैं. थर्डली जो हम बात कर ले वार्निंग साइन एंड सिम्टम्स, लंग कैंसर जितना जल्दी पता लग जाए उतना इजी होता है उसको ट्रीट करना. बट अनफॉर्चुनेटली इन इंडिया लंग कैंसर फोर्थ स्टेज में पता लगता है. तो अगर किसी को खांसी है, अगर किसी को आंख में खून आ रहा है, if there is a blood in sputum, if there is continuous cough, now these sign and symptoms can be common with tuberculosis also. So people get confused like whether we have a cancer or not. But along with them, along with these sign and symptom, if you are having a progressive loss of weight, अगर वजन लगातार गिरते जा रहा है, अगर लास्ट 4-5 महीने में आपका 8-10 किलो वजन गिर रहा है, तो आपको अलर्ट हो जाना चाहिए कि हमको ये सिम्टम्स लंग कैंसर से एसोसिएटेड हो सकते हैं। तो इन कंडीशंस को पहचाना, भूख नहीं लगना, सडनली भूख मर जाना, वजन कम होना, ब्लड इन द स्पूटम, कंटिन्यूस कफ और छाती में दर्द, अगर ये सारे सिम्टम्स एक साथ आ रहे हैं तो आपको एक बहुत जल्दी अपने नियरेस्ट ऑन्कोलॉजिस्ट से विजिट करना चाहिए और जल्द से जल्द एटलीस्ट एक छाती के सीटी स्कैन करवा लेना चाहिए। यस।
That's very informative. I think awareness is the first step in this condition.
यस।
So since we are talking about the risk factor, let's bring in an important concern, that is air pollution, especially with Delhi's AQI at the alarming level these days. So what role does environmental exposure play in lung cancer cases, and what preventive measures should be taken?
Yeah, the environmental pollution is such a big issue, not only related to lung cancer but to other diseases also. Now, this, if we talk about the environmental pollution, I think it is our job as civilian citizens uh, to avoid as much as environmental pollution by the use of less combustive materials, by to taking care of our own vehicles, whether it is giving a lot of air pollution in the market or not. So I think instead of telling to other people, we should start from our own home. So yeah, and environmental pollution is a broader reason, and it has all the pollutants and gases I have discussed in my first answer, like radon and other gases, which if leads to poisonous smoke, can further increase the lung cancer. As far as there are measures to cut it down, obviously we need to take care of the government policies. What have they decided? What are the rules and regulation to check the AQI of a particular area? And if we can't avoid that, at least use a mask or any preventive filters in that particular area. If you are living in that high industrial area, high pollution zone, you can use air filters at your home in order to avoid the other problems. Yeah, so these are the steps we can take.
Yeah, that's an important perspective. Moving ahead, let's talk about how lifestyle and preventive care fit into this picture. So, how can lifestyle changes and preventive health care be better integrated to reduce lung cancer incident?
The preventive care, as I've discussed, is the smoking is the most of the important cause of lung cancer. So we should start from the basic that we should continuously avoid smoking from our home and to educate the people that they should cut down the smoking. Now, when I have people who have come to me in my OPD and they said कि तुमको lung cancer हो गया है and they are smoking from past 30-40 years. So one of the person who is sitting next to them he said कि सर हमारे साथ वाले तो 10 साल से पी रहे उनको नहीं हुआ. तो आई थिंक दिस इज अवेयरनेस कि उनको ये समझाना पड़ेगा कि हम इसका वेट नहीं कर सकते कि किसी को होगा तभी हम ये बात मानेंगे. So I think if we are seeing around how many lung cancer cases are increasing and it's clear cut related to smoking. So one of the preventive aspect is to align with our own self, our relative, our friends, with the little health workers to educate them the harmness of smoking. And I think government has done wonderful job is to put some kind of pictures over tobaccos and over cigarette packets to ensure people that this can be the future of yours. So I think one is awareness among ourselves, self-awareness, and that too to be transported to another people around you. I think this is the best way that we can use the preventive strategies to prevent lung cancer.
Nicely explained, doctor. I think small habits can make a big difference. Now let's move to early detection and screening methods. So, what advancement in screening techniques have had the biggest impact on early detection of lung cancer?
Yeah. So before I answer that, I would like to tell my audience that what exactly screening is. Screening का मतलब ये होता है कि कोई भी नॉर्मल इंडिविजुअल जिसको कैंसर नहीं है, हम उनमें कुछ ऐसी जांच करें जिससे कि हमको कैंसर होने के पहले पता लग जाए कि कैंसर अगर है भी तो वो बहुत कम मात्रा में है. मतलब हम नॉर्मल इंडिविजुअल्स के अंदर ही ऐसे टेस्ट करें जिसमें कि अगर कैंसर होने वाला हो तो हमको पता लग जाए। यूजुअली स्क्रीनिंग स्लो ग्रोइंग कैंसर्स में काम आता है, जैसे कि ब्रेस्ट कैंसर, इसमें कि गवर्नमेंट की गाइडलाइंस है। जहां तक लंग कैंसर का सवाल है, वी हैव अ गाइडलाइंस फॉर लंग कैंसर स्क्रीनिंग। नाउ द एडवांसमेंट इज वी यूजुअली हैव अ लो डोज सिटी स्कैन। सो यूजुअली व्हेन आई से लो डोज सिटी स्कैन, इट मींस इस सिटी स्कैन का एक्सपोजर इतना नहीं होता जितना एक नॉर्मल सिटी स्कैन का होता है, जो कि एक नॉर्मल इंडिविजुअल के लिए हार्मफुल नहीं है। सो लेकिन वी कैनॉट डू टू एवरी इंडिविजुअल द लो डोज सिटी स्कैन। ओनली द हाई रिस्क इंडिविजुअल्स, जिनकी एज 50 to 80 ईयर्स है, जिनकी लास्ट 20 ईयर्स से हिस्ट्री ऑफ स्मोकिंग है, एटलीस्ट 1 पैक ऑफ सिगरेट पर डे फ्रॉम 20 ईयर्स, और जिन्होंने स्मोकिंग पहले करते थे लेकिन लास्ट 10 से 15 साल में ही छोड़ी है, वो लोग आइडियल कैंडिडेट्स है इस टाइप के स्क्रीनिंग के लिए। तो एक साल में एक बार अगर हम एक लो डोज सिटी स्कैन इन हाई रिस्क इंडिविजुअल्स में कराते हैं, तो इन एडवांसमेंट से हम लंग कैंसर को स्क्रीनिंग कर सकते हैं, और लंग कैंसर की गठान को या लीजन को बहुत कम स्टेज में पता लगा सकते हैं। तो आई थिंक विद द एडवांसमेंट ऑफ low dose CT scan, we can diagnose patient at an early stage.
Very interesting, doctor. I think technology is clearly shaping the early diagnosis.
Yes.
Moving to next question. How can we increase access to lung cancer screening, particularly in underserved population?
So I think mostly in underserved population आज भी लोग चेस्ट एक्सरे के ऊपर डिपेंडेंट है। तो आई थिंक जो स्क्रीनिंग गाइडलाइंस है, जो वहाँ पर एएनए वर्कर्स होते हैं, जो आंगनवाड़ी वर्कर्स होते हैं, जो ग्राउंड लेवल पर नर्सिंग स्टाफ होते हैं, जो वहाँ पर पीएचसी के डॉक्टर्स होते हैं, सबसे पहले हमको उनको अवेयर करना जरूरी है। तो आई थिंक इसका सबसे अच्छा तरीका है, अब एक छोटे से पैम्पलेट पे अगर हम एक स्क्रीनिंग गाइडलाइंस को प्रिंट करके उनको दे दे और एक सरल भाषा में समझाया जाए, तो आई थिंक उसी तरीके से वो वहाँ की पॉपुलेशन को एजुकेट कर सकते हैं इन द ग्रुप ऑफ 40 and 50। So I think this is how word to word people will get aware in underprivileged population, और वो समझ पाएंगे कि साल भर में एक बार सिटी स्कैन कराने से ये फायदा है कि अगर आपका जो कैंसर चौथी अवस्था में पता लग सकता है, वो कम अवस्था में अगर पता लग जाए, क्योंकि चौथी अवस्था का लास्ट स्टेज के लंग कैंसर का सर्वाइवल और फर्स्ट स्टेज के लंग कैंसर के सर्वाइवल में बहुत फर्क है। तो अगर हमें सारी भाषा वहाँ के लोकल डॉक्टर्स, नर्सिंग स्टाफ और वर्कर्स को समझाएंगे, तो वो वहाँ की लोकल पॉपुलेशन को अपनी लोकल लैंग्वेज में और इजीली एक्सप्लेन कर सकते हैं। सो आई थिंक एजुकेट वन विच कैन एजुकेट मोर, आई थिंक दैट इज द बेस्ट पॉलिसी।
You rightly mentioned, and it's a valuable point. So, moving to next question, what challenges do healthcare providers or doctors face in implementing widespread lung cancer screening program?
So I think the first challenge and any healthcare provider faces whether he or she himself or herself is aware or not, कि उनको
Yeah.
खुद को पूरा करेक्ट पता है कि नहीं। तो मेरा ऐसा मानना है कि अगर हम किसी को अवेयर कर रहे हैं, सबसे पहले हमको क्लियर कट खुद पता होना चाहिए कि हमको कम्युनिकेट क्या करना है। तो सेल्फ अवेयरनेस इज द फर्स्ट थिंग, सेल्फ एजुकेशन इज द फर्स्ट थिंग, सो दैट हम अपने आसपास के लोगों को राइटली एजुकेट कर सकते हैं। सेकेंड हर्डल जो आता है, क्योंकि हम सिटी स्कैन की बात करते हैं, तो फाइनेंशियल इश्यूज अंडर प्रिविलेज पॉपुलेशन में, और जो आसपास की विलेज पॉपुलेशन है, रूरल पॉपुलेशन है, वो आता है। तो आई थिंक लैक ऑफ अवेयरनेस, लैक ऑफ एजुकेशन, अ फाइनेंशियल लिटिल स्टेटस, एंड ऑल्सो एक्सेप्टेबिलिटी, कि हम लंग कैंसर को रोक सकते हैं, उसको इग्नोर नहीं कर सकता है। ये कुछ बेसिक 3-4 हर्डल्स है जो हमें अंडर प्रिविलेज पॉपुलेशन में फेस करने को मिलती है हमारी ओपीडीज के अंदर। जी।
These are the practical insights, I think. And now let's shift towards the treatment side. Some amazing developments are also happening there. So, what are the latest breakthroughs in targeted therapies and immunotherapies for lung cancer treatment?
तो आई थिंक इट्स अ वेरी वेरी इंपॉर्टेंट क्वेश्चन। अगर मैं लंग कैंसर के ट्रीटमेंट को लास्ट 10 साल पहले और आज की बात करूं, तो जमीन और आसमान का अंतर है। द ट्रीटमेंट हैज एडवांस सो वंडरफुल। We should thank to all the scientists and doctors who have worked hard for it, so that now we have a specific target therapy, and another word you have used is immunotherapy. So मैं मेरी ऑडियंस को बहुत सिंपल लैंग्वेज में समझाना चाहूंगा कि टारगेट थेरेपी और इम्यूनोथेरेपी होती क्या है। सो टारगेट का मतलब ये होता है कि हमारे बॉडी में कोई एक ऐसा पर्टिकुलर म्यूटेशन मिल जाए जिसको हम टारगेट कर सके। इट्स जस्ट लाइक उस म्यूटेशन को हम बोल सकते हैं ड्राइवर म्यूटेशन। उनके लिए हमको क्या टेस्ट कराने वाले हैं वो मैं अपने आगे इंट्रैक्शन में एक्सप्लेन करूंगा। सपोज आपने लंग कैंसर की कोई एक अच्छी जांच कराई जिसमें कि आपको ये पता लग गया कि इस लंग कैंसर का होने का ये पर्टिकुलर म्यूटेशन कारण है। अब वो हो सकता है अनुवांशिक हो यानी कि जेनेटिक हो, या हो सकता है जो आप बायोप्सी की जांच कराते हैं उसके ऊपर आपको वो म्यूटेशन मिल गया। अगर आपको वो पर्टिकुलर म्यूटेशन मिल जाता है इसका मतलब वो म्यूटेशन मेजर रीजन है उस लंग कैंसर को कराने का, खासकर नॉन स्मोकर्स में। अगर हम उस स्पेसिफिक म्यूटेशन को टारगेट कर दें, जो कि अच्छी बात यह है आज के तारीख में हमारे पास 80% टैबलेट्स के फॉर्म में, यानी कि खाली एक गोली के फॉर्म में उपलब्ध है, तो उसको हम बोलते हैं टारगेट थेरेपी। एंड फॉर लंग कैंसर वी हैव 15 to 20 टारगेट्स अवेलेबल, एंड फॉर ऑलमोस्ट 70% ऑफ देम हैव oral therapies available. So I think this is called the target therapy. Our first job is to find a relevant target. If we find it, then we can use a particular target therapy for that target. So I will discuss in detail in further questions. Now, the second part is immunotherapy. So in the last 5 years, 7 years, immunotherapy has done a major contribution for lung cancer. So basically, immunotherapy क्या है? The major role of immunotherapy is to enhance the immunity of our own body that can fight against the cancer. तो मैं बहुत सरल साइंटिफिक भाषा में समझाता हूँ। हमारे बॉडी में टी सेल्स होते हैं जिसके ऊपर एक रिसेप्टर होता है PD1, और जो कैंसर सेल्स होते हैं उनके ऊपर एक रिसेप्टर होता है PDL1। जब कैंसर सेल्स बॉडी में आती है तो ये दोनों आपस में मिलते हैं और एक नेगेटिव सिग्नल बनाते हैं, जिससे कि टी सेल की मात्रा कम हो जाती है और कैंसर सेल्स बढ़ने लग जाते हैं। और वो हमारी बॉडी के टी सेल्स को कम करके नेचुरल इम्यूनिटी डिफेंस को खत्म करके बॉडी में कैंसर कराते हैं। जो इम्यूनोथेरेपी होती है वो एंटी PD1 और एंटी PDL1 होती है, यानी कि PD1 और PDL1 से जो नेगेटिव सिग्नल आ रहे हैं, कैंसर कराने के सिग्नल आ रहे हैं, उनके अगेंस्ट काम करती है, जिससे कि बॉडी की टी सेल्स की यानी कि जो हमारी नेचुरल इम्यून सेल्स है, इम्यूनिटी है, वो बढ़ने लग जाती है और उनसे कैंसर के लड़ने की क्षमता बढ़ने लग जाती है और वो कैंसर की सेल्स को खत्म कर देती है। तो जो हम कीमोथेरेपी मरीजों को कैंसर खत्म करने के लिए देते हैं, इनका काम है कैंसर को मारना, अगर वो कीमोथेरेपी हम इम्यूनोथेरेपी से मिला दे तो बॉडी की इम्यून सिस्टम भी कैंसर पे काम करती है और कीमो भी काम करती है। तो दिस इज हाउ द इम्यूनोथेरेपी वर्क्स। सो आई थिंक टारगेट थेरेपी एंड इम्यूनोथेरेपी in current scenario are the major treatment options for lung cancer. Yes.
Thank you, doctor. I think this talk is very encouraging for the patient. Building on that, how has precision medicine changed the way lung cancer is treated?
Okay. So I think nowadays, without precision medicine, we can't move a step ahead. So just coming back to my previous question, I was talking about the mutation testing, the immunotherapy testing. Now, how does precision medicine help into it? Now, precision medicines mean that you should be very precise. Like you don't like if somebody has a lung cancer, you need to find a precise thing that we can target so that there should be less toxicity and the specific target can be hit to prevent that lung cancer. Now, how can it be achieved? Nowadays, we have a lot of tests, and the most important test we have is NGS, that is next generation sequencing. Now, how does it work? Suppose we did a biopsy of a patient to prove whether it is lung cancer positive or negative. In that biopsy sample, we made a tissue block. So we run that NGS test on the tissue block and we see some various mutations, especially 15 to 20 strong mutations. If any of those mutations comes positive in that report, we can apply that target therapy for that particular mutation, and that is called the precision medicine. So the basis of precision medicine is to do a particular test जिससे कि हमको पता लग जाए कि किस म्यूटेशन के कारण से हमको कैंसर हुआ है। अगर हमको म्यूटेशन नेगेटिव मिल जाता है तो भी हमको ये पता लग जाता है कि नाउ कीमोथेरेपी विल वर्क बेटर इन दैट पेशेंट। सो दिस इज व्हाट कॉल्ड इज प्रिसिजन मेडिसिन। Also on NGS testing, we do a receptor testing called PDL1, जिसकी मैं इम्यूनोथेरेपी के रिस्पेक्ट में अभी बात कर रहा था। जितना PDL1 एक्सप्रेशन बॉडी में उस ट्यूमर में ज्यादा होगा, उतना ही अच्छा इम्यूनोथेरेपी काम करेगी। तो कुछ पेशेंट्स ऐसे होते हैं जिनमें की टेस्ट के अंदर टारगेट्स तो नेगेटिव आते हैं, लेकिन PDL1 पॉजिटिव होके काफी हाई आता है। इसका मतलब उन पेशेंट्स में टारगेट थेरेपी काम नहीं करेगी, इम्यूनोथेरेपी काम करेगी। तो प्रिसीजन मेडिसिन हेल्प्स टू अंडरस्टैंड which medicine to be given to which patient. So it's a very important part.
Excellent, doctor. I think precision care is indeed the future. Moving to our next topic, teamwork in patient care. Can you discuss the role of multidisciplinary care in managing lung care patient?
So, any lung cancer patient, when it comes to oncologist, it does not come directly to us. It basically comes with the reference of someone. Like if a patient have difficulty in breathing, if a patient has blood in the sputum, nobody is going to go to the cancer specialist directly. They mostly go to the physician or to the chest physician. Now, when they diagnose the patient, and you know the patient is a smoker and it has some lung cancer sign and symptom, then they send to us. But lung cancer problem is not the only problem that patient is facing. The patient must be having COPD, patient must be having emphysema, patient must be having might be a coexisting tuberculosis. So there are various other benign infections along with the cancer that can be there. So I think in that scenario, multidisciplinary team action plays a phenomenal role. I think if I'm treating a cancer patient, most of the time, I had a word with or I refer the patient to a chest physician or another physician, so that if other medical conditions needs treatment, that can be very beneficial for the patient. Because if you're treating only cancer and other conditions are not taking care, that we call it supportive care, then even the cancer treatment will not work too good. So in that scenario, the multidisciplinary team action works very well. Sometimes in multidisciplinary team action, also along with medical oncologists, there is the role of surgical oncologist and radiation oncologist. Like if a cancer is diagnosed at an early stage, then it might be removed. So you need to take an opinion of surgical oncologist. If a cancer is in third stage, not the fourth stage, then after giving the chemo or target therapy, when the lesion has decreased in size, then you can give the radiation and for a curative intent. So this is how the multidisciplinary team action is very important for the benefit of a patient. Yes.
Thank you, doctor. You highlighted it very well, and I think teamwork really matters in all the tasks. Moving forward, what are the future possibilities for personalized lung cancer treatment, and how can patient gain access to innovative treatments?
So I think now around 3 5 years back, the test which I'm saying there is the NGS testing, the target mutation test, that those tests were very expensive. But in the coming last 2 to 3 years, the cost of the tests have decreased too much. So first of all, we need to explain to the patient that there are a lot of tests. The cost of the tests have decreased. Also, there are various supportive programs available in the market in which you can get this test done in free of cost also. So I think we should aware that things to the patient that these tests are not non-achievable, and I think that's the major thing we can do to aware them. And if they agree for them, and if we find a mutation, then we have the whole lot of target therapies available for the patient. Yes.
So, doctor, now let's talk about the patient well-being and the emotional support that is very important for a patient. So, how do we ensure that patient diagnosed with lung cancer receive the psychological support they need throughout their treatment journey?
So ideally, not only for lung cancer, I think for every cancer patient, there should be a dedicated cancer psychologist should be available there. But we all know that on practical purpose, that is not possible in every hospital. So I think when we do our studies, we have been told and we learn how to counsel and how to talk to oncology patients. Basically, in India, I think most of the oncologists only do the psychological counseling. Now, the very important part of psychological counseling is you should have not sympathy but empathy to the patient. कोई बेचारा दिखाने की जरूरत नहीं है, आपको उनको सपोर्ट सिस्टम बनना है। आपको उनको ये बताना है कि उम्मीद जितनी भी है पर है. So you have to be honest to the patient, but you have to be supportive and empathize to the patient. So whenever patient comes to me and I see the report of a lung cancer, first of all I make the patients, I have a decent word with the patient. आप कैसे हैं, आपको क्या तकलीफ है, listen to their problems in a very polite manner, ask them what are their complaints. You can politely ask them to sit outside, then you can have a discussion with the relatives that he or she is suffering from cancer and this the stage. You can have a discussion with them that whether they have told them to the patient or not. If they have not told to the patient, you don't need to say this patient upfront on the first day, the first time. You can tell them that you can discuss among your family, you can disclose this news to them, and then you can come to me so that as a family I can counsel you what are the possible options. Secondly, your explanation of treatment, of investigation should be very clear cut. It should not be that one thing you are saying at one day, you forget, and then you are again calling them. That might create a lot of problem with the patient. So you should be very precise in your communication skill that these are the investigation, these are the treatment option available, and you should always give them time to decide. That you can go home, discuss with your family, your financial status, your condition. So I think this gives a confidence to the patient that yes, we have the time and there is no such thing that nothing can be done. So I think these are few little small steps we can do to encourage the patient to take the treatment.
This is a very important discussion you have done, and patient well-being is very important that we all take caring for that. Moving ahead, how can better education empower patients in their treatment journey?
I think we have already discussed that education for quitting smoking, education that they should not be. Yeah, one important point is I have a lot of patients in my OPDs, and they say that if I see the CT scans and there is a big lung mass and there are liver mets, and it's clearly visible on the PET scan or CT scan that he or she is suffering from cancer. Now to diagnose the lung cancer, you need to do the biopsy. So मुझे बहुत सारे पेशेंट ओपीडी में आके बोलते हैं सर बायोप्सी कराएंगे तो कैंसर बढ़ जाएगा, कैंसर फैल जाएगा. मैं इस इंटरेक्शन के माध्यम से कहना चाहता हूँ कि बायोप्सी कराए बिना आप डॉक्यूमेंट नहीं कर सकते कि आपको कैंसर है. और उसके ऊपर हम एक टेस्ट लगाते हैं आईएससी, जिससे पता लगता है कि वो स्मॉल सेल है, स्क्वामस सेल है कि अडीनो है. और इन तीनों की दवाइयां अलग अलग होती है. तो आई थिंक बायोप्सी इज ए इम्पोर्टेंट पार्ट ऑफ कैंसर डायग्नोसिस. तो अगर आपको कोई भी ऑन्कोलॉजिस्ट बायोप्सी एडवाइस करता है तो ये एक एजुकेशन का बहुत इंपॉर्टेंट पार्ट है कि आपको उससे डरना नहीं है. यू नीड टू गो विद द बायोप्सी. बहुत ब्रोंकोस्कोपी गाइडेड बायोप्सी भी हो सकती है, सिटी स्कैन गाइडेड बायोप्सी भी हो सकती है. डिपेंड करता है लंग में मास कहाँ पर है. और सेकेंडली, थेरेपी से घबराना नहीं है. कैंसर से बड़ा प्रॉब्लम इलाज नहीं हो सकता. सो इफ देर आर माइट 5 to 10% साइड इफेक्ट, इट इज स्टिल मैनेजेबल, बट इट इज नॉट मोर देन द डिजीज इटसेल्फ. सो द फियर, जो डर है, जो आसपास के आपके लोग हैं जिनको एजुकेशन नहीं है, उनसे बेटर है कि आप एक ऑन्कोलॉजिस्ट से जाके मिलिए, उनसे राइट सही इंसान से सही इंफॉर्मेशन लीजिए. सो आई थिंक राइट इंफॉर्मेशन फ्रॉम अ राइट पर्सन कैन ऑल्सो एजुकेट यू टू गो फॉर द राइट ट्रीटमेंट.
Thank you, doctor. I think clear communication is most important. Clear communication patient की confidence को भी build करता है, तो it's most important. Now let's focus on the caregiver and their essential role. So how can caregivers and the healthcare system work together to improve the quality of life for lung cancer patient?
So I think uh, treating a lung cancer patient is not only a job of oncologist. In caregiver, if I include the nursing staff, so the moment the patient goes from my OPD and get admitted, now the caregiver, the nursing staff should be very compassionate, because from inserting the cannula to the patient, it's a painful procedure for some of them. From starting the chemotherapy drug, so I think all these procedure is very important on the part of caregiver. So if a nursing staff is good, well trained, can do inserting the cannula in one go in a smooth manner, if he or she knows whether to use a glass bottle, if they are able to follow instructions, if they are communicating with us properly. So I think in that manner, plays a very important role. On the humanitarian ground, if the caregiver is polite to the patient, and if the patient is having anxiety, and if they can calm it down, और वो उनकी मदद कर सकते हैं कि आपको घबराने की जरूरत नहीं है, ये रूटीन प्रोसीजर होता है, इतना ही मरीज के लिए बहुत होता है, जिससे कि उसका ट्रीटमेंट की जो जर्नी है वो आसान हो जाती है. देयर आर लॉट ऑफ लंग कैंसर पेशेंट्स हु कम्स टू अस इन स्टेज 4. देयर माइट बी बोन मेटास्टेसिस, देयर माइट बी लिवर मेटास्टेसिस. सो इफ देयर इज अ लॉट ऑफ पेन, a caregiver can give the injection, the painkillers at the right time, and addressing to the patient problem and communicating to us at the right time. If this teamwork is happening, fine. So this is very important on the respect of caregiver. If you talk about the family relatives, I think without their psychological and emotional support, I think none of the cancer patient can take their treatment forward.
Thank you, doctor. I think a caregiver is the second support system for the patient. And now let's move to the patient advocacy and the community engagement. So, how do we break the stigma often associated with lung cancer, especially in non-smokers?
So I think a lot of patients tell me कि सर स्मोकिंग से ही तो होता है लंग कैंसर, लेकिन इनको हुआ है तो स्मोकिंग भी नहीं करते थे, ये तो बीड़ी भी नहीं पीते थे, ये तो तंबाकू भी नहीं खाते थे, कुछ तो बोलते थे तो चाय भी नहीं पीते थे, फिर इनको लंग कैंसर कैसे हो गया. तो आई थिंक मैंने मेरे फर्स्ट क्वेश्चन के आंसर में बताया था कि एन एन इम्पॉर्टेंट पार्ट ऑफ इट इज सेकेंड हैंड स्मोकिंग. आप खुद स्मोक नहीं कर रहे, एंड दैट इज द पार्ट ऑफ अवेयरनेस कम. लेकिन अगर आपके फैमिली रिलेटिव्स, आपका ऑफिस स्टाफ, आपके फ्रेंड्स, अगर आपके कलीग्स वो रेगुलर स्मोकिंग कर रहे हैं और आप उनके साथ बैठे हैं, तो ये भी एक बहुत इंपॉर्टेंट फैक्टर है. तो आई थिंक आपको खुद भी स्मोकिंग रोकनी है और अपने आसपास वालों को भी मना करना है. और इफ somebody इज नॉट क्विटिंग, यू नीड टू मेक अ डिस्टेंस, फर्स्ट स्टेप. तो ये स्टिग्मेट हमको बताना पड़ता है कि आपके आसपास जो स्मोकिंग हो रही है वो भी आपके लिए harmful है. Second stigma is that yes, smoking is not only the cause, as I told you, radon and various other metals and environmental pollution. So we need to tell them that these are also the causes that can lead to the lung cancer. और साथ ही साथ हमको ये बताना पड़ेगा, जैसे कि मैंने बताया कि नॉन स्मोकर्स में एक अडीनो कार्सिनोमा वैरायटी होती है जो मोस्ट कॉमन होती है, और इन पेशेंट्स में टारगेट म्यूटेशंस का मिलना बहुत कॉमन होता है, जिससे कि ट्रीटमेंट आसान हो जाता है और मरीज की जीने की उम्मीद थोड़ी और बढ़ जाती है. तो आई थिंक ये सारे पॉजिटिव फैक्टर से हम लंग कैंसर को नॉन स्मोकर्स के अंदर स्टिग्मेटा को दूर कर सकते.
Well said, doctor. Now let's move to the role of the policymakers in awareness and the prevention of the lung cancer. So, what can policymakers and the governments do to enhance awareness campaign and the lung cancer preventive efforts?
So we have a set of guidelines available. Anybody can go to the Google and have a look at it. But the major factors the government has did is to put a picture of a cancerous person or the disease picture itself on the packet of a cigarette and the gutka wrapper. So I think whenever somebody buys it, the first thing is the fear they should have once they have a look at it. I think it's a wonderful government policy that they have applied so that people can be aware at that time only that if somebody is buying. So I think this is a wonderful policy. Also, I think they have government rules and they have some fines if people is smoking in a public place. So some fines are also there from the government. They have the law has to be followed. So good law policy of not smoking in public places. Also, there are a lot of non-smoking zones, especially around the schools, around where young children is there. I think with these little steps, the government has doing a major thing in order to cut down the lungs smoking. Also, if we talk about the non-smoking part, cutting down the environmental pollution is a very important part. Awareness about screening so that lung cancer can be diagnosed at an early stage. Also, educating the workers who are working in asbestos factories and various uranium and chromium factories to use the proper precautionary measure of wearing the proper mask, gloves can also help in preventing the lung cancer. Yeah.
Thank you, Dr. Pulkit. And what is your last message for the community?
So my last message for the community is, as we all know, that smoking and tobacco chewing is a major cause for lung cancer. Please avoid it. Please avoid sitting in those areas where smoking is continuously going on. My special message is for the younger generation who are the bright future for their upcoming life. I have seen in schools, colleges, periphery, in a lot of IT sector, in a lot of offices, even around hospitals, a lot of young crowd smokes a lot. Please avoid it. It's not a cool thing. It's not a good cultural thing. If you're going in the party, you can enjoy even without having a smoking. So please avoid it. Don't get inspired by wrong people, by wrong things of smoking, because your body is wonderful thing the God has given you. I think if you take care of it, the body will also take care of you. Please be very well aware around your surroundings. If you have seen a lung cancer patient around your surrounding, you can learn from them what kind of suffering they go through. Pass on the good message to your colleagues, to your brothers, sisters, sons, daughters. And if we all together can do a cumulative effort along with the government policies following by decreasing the other non-smoking cause, I think हम सब मिलके lung cancer को बहुत हरा सकते हैं. So with this talk, I wish you lots of luck. I hope my session will be helpful for you to understand the risk factors, the preventive factors, the management, and the future life possibilities to treat lung cancer. Thank you so much.
Thank you, Dr. Pulkit, for sharing such valuable insight throughout our discussion. As we mark Lung Cancer Awareness Month, it's a reminder that early detection, lifestyle awareness, and collaborative healthcare can change outcomes for thousands. We also thank Roche for their support in making this awareness initiative possible. And thank you to everyone who joined us today. Stay healthy, stay aware, and take care of your lungs. Thank you.